Welcome, folks. We'll let everybody have a minute to join us. Hope you're all staying nice and cool in this very balmy weather. And that wherever you find yourself, you're being careful, not only in the heat, but with the air quality issues that we're having with the smoke from the wildfires in Canada. Feeling really worried about our partners and neighbors in the north. All right, we are going to get started. We have a lot to cover today. We're really grateful for you joining us again. As a reminder, this is our third in a series of four webinars that are focused on supporting our business community leaders, those folks who actually work with our employers, with a focus this time on financing solutions. Really, you know what to do. How do you actually pay for it? We're joined here today with some really impressive folks who are going to help us walk through what those options are. Because it's good to note that employers don't have to shoulder the full cost alone. There are existing public incentives, tax credits, share cost models, and strategic investments that significantly reduce the cost of supporting employees with childcare. And so, next, please. I want to do a little bit of housekeeping. We're all very familiar with Zoom webinars now, but just so you know, it'd be great if you could introduce yourself in chat, include your name, organization, sector, and location. That gives us an idea of who's here. So we also record this Zoom so that we can share it with folks who are registered but can't attend, or if you want to watch it again because you need to be reminded of something. Those will come to you in your email. Just a note that they often end up in people's spam, so make sure you check there. They will be coming out within 48 hours or close to that. We have a Q&A feature to submit questions. We will be monitoring that. So as you have questions and they come up, please put them in there and we'll make sure that they get answered. We would also like you to participate in our polls, and any discussion prompts that we have through chat is helpful. And if you need closed captioning, those are available through Zoom for you. Again, I told you we've got a lot of experts today. I'm really happy to be joined today by Emily Laidlaw, who is the Deputy Director of Early Childhood Education at MiLEAP, and she's going to help me moderate today's session, which includes a friend from Niskanen Center, Josh McCabe, one of our great employers in the country, Megan Schulte with Frontier Co-op in Iowa. We've got from MiLEAP, Shannon Garrett, who is going to tell us all about MyTriShare. And then we are joined last but not least by two of our champions in the state that come from Bronson Healthcare, Charity Alderson and Chelsea McMullen. And we're going to tell us what the on-the-ground implementation of childcare solutions looks like for them and what their journey has looked like, what they're learning, etc. So who is Pulse, in case you don't know who we are? We are a co-led effort dedicated to transforming the early childhood landscape. We want to help communities with data-driven solutions. And one of those things is by partnering with folks like our state folks in MiLEAP, as well as at Early Childhood Investment Corporation, and all of our employers to make sure that people have what they need to make good decisions about how we address systemic challenges that face our families with young children. We are going to actually set this up as a poll. So want you to take a look at the descriptors that are on your screen right now. And we'd like to get a sense of who's in the room. And so that's going to pop up here in a second. And when you answer, we're going to be able to see the results so that we have an idea of where you're sitting. So are you just beginning to learn about challenges? Do you know that it affects your workforce, but you aren't sure what to do? You're implementing things, you're actively investing, and are you actively supporting businesses to take action? So that's for those folks who may not be employers themselves, but are actually supporting those who are. And it looks like we've got a lot of those folks in the room right now. Which is great, because when we all come to the same conclusion about what we're sharing, and we're talking about this in a way that is very much at an intersectional approach to how we do our work, and that we can see that childcare isn't a family issue, it's an economic and workforce infrastructure issue. And therefore, all of us have a stake in actually trying to create solutions that are going to work for everyone. All right. So we're at about 75%. This is great for us to be able to note where you are right now. So thank you very much. Sharing those results so that folks can see it for a second. Yeah. All right. We can stop. I think we were both doing it. Sorry, guys. My teammate and I were both doing the same thing on the poll. So it was, I think we were canceling each other's thing. So I need to exit out of it. All right, next. Thank you, Angie. Just to recap, if you weren't able to join us for webinar 1 and 2, I want to give just a heads up that both the recordings are available on the Pulse Roadmap website. You can visit there and you will see the slide deck as well as access to the recording. But just so you know, webinar 1 was really focused on kind of setting the stage around childcare as a workforce strategy. And we were joined by the U.S. Chamber Foundation, the Atlanta Fed, Business Leaders United, MiLEAP, and CalSec as our employer champion, to talk about why it's a workforce strategy and what we can do about it, right? What's the impact on our economy overall as a country, as a state? What data are we using to actually get there? And all the research that the Atlanta Fed has done has been really helpful. How it impacts talent attraction. The Business Leaders United group is really invested in that, and all the things that Michigan is doing, because we need to be proud of where we're living right now, because this is an administration that has taken this seriously and has put resources and policies in place that help us. And then the second webinar, it's okay, was focused on getting to yes. And that was really about not having to start from scratch, right? We borrow brilliance. We work with partners like Bipartisan Policy Center who can help us understand who else is doing what. We've got the Pulse Roadmap that can help you navigate what you need to do, including starting with listening to your folks and understanding what their needs are. And then listening to our childcare champions who share what it took to get to yes, and they make progress. And we heard last time from Duncan Aviation and Hemlock Semiconductor. If you did not listen to that webinar yet, I highly, highly recommend it. It was an incredible one. And I want to give a special shout out to those partners who made it so rich. So just another little foundation setting before we dig into the content for today is just a reminder that the childcare crisis is a business crisis, like not just in the Midwest, everywhere right now. Limited childcare options quietly reshape the labor market, which means that employers struggle to attract and retain workers, parents sit on the sidelines, and we need to make sure that we are creating solutions that are going to work for all. That means the families themselves, the children who need the care, but also our employers and our business leaders. And so what does this cost us? In Michigan, it's almost $3 billion annually. And we know that there are over half of the parents who have been surveyed through the U.S. Chamber Foundation's Untapped Potential Report that stated that they had to adjust their work or school training due to childcare issues, and that 14% left a job. So we're leaving people on the sidelines who could be working, but they can't because they cannot find the childcare that they need. So we know that childcare is workforce infrastructure, because without reliable childcare, parents miss work, they reduce their hours, they leave jobs, they delay employment. That impacts your workforce in ways that are higher turnover, recruitment challenges, reduced productivity, and increased absenteeism. And we have a gap. So ours is on par with the national average. So if you look at Michigan, we have over 430,000 children potentially needing childcare, with our supply being just over 311,000. That leaves a 28% gap. So that means families, these are not just numbers, these are families who are struggling to find the care they need and can't, because it is a business model that is really challenging and requires us to be thinking about how we shore it up collectively. So we want to make sure that you know what to do and where to go. So in order to step into this space and really actually take action, you need to find your people. We encourage you to join your regional childcare coalition. If you do not know how to do that, reach out to us and we'll make sure that we get you connected. We want you to make sure you borrow brilliance, utilize our roadmap, understand that there's plenty of information out there from our partners, and you'll get a lot of those resources in the slide decks that you're going to be receiving through these webinars. And then identify when you're participating in this, one thing you could do immediately, starting conversations, putting yourself in spaces where people are talking about this so you can learn more. There's always something you can do because ready is a myth. You can start anywhere you are with whatever you have. So now we're moving into the meat of what today is about. And so why you've actually registered for today is to talk about investments, funding, and ROI. We want to really get real about the fact one of the main questions we get from employers when we're engaging them is, what is this going to cost me? How do I budget for this? What are the options that I have for tax incentives or tax credits? It's a very unknown territory for a lot of employers. And so we want to make sure that we're taking away some of the confusion. And it's not even confusion, but sometimes it's just a lack of understanding. And so we're going to get into that right now. Because we know that if we don't invest it, it still costs us, right? We've talked about these earlier, but just I can't emphasize them enough that you're already paying as an employer through absenteeism, turnover, the recruiting costs that you incur, the overtime you have to pay when you don't have enough staff, the productivity that gets lost when people are not able to be there. Folks who are not going into leadership positions because they have to delay those promotions because they can't find care. And then you've got reduced workforce participation overall, the people that are sitting on the sidelines that want to work but can't. And we've know through some major studies that you see listed on this slide right now that they all come to the same conclusion. Child care benefits pay for themselves because you reduce turnover, lower absenteeism, and you have higher productivity. But the opportunity remains vastly untapped. Only 13% of civilian workers have access to employer-provided child care. And that means in any form, right? So we do know that there's a lot of room here for you to make yourself more competitive to people who are looking for work. And employers have more financial tools than ever. That's the good news, right? We're going to talk about a few of those today. And just so you know, the first emphasis is going to be on 45F, which has gotten a lot of attention lately and was pretty unknown for a while when we first started doing this work in Michigan. And we do know that it's way underutilized. We also know that there are things like employer subsidies, cost share models. We're going to get into TriShare or my TriShare that I talked to you about. That is a really exciting innovation that came out of Michigan. And while we're not going to dig deep into it right now, there is supply building investments that can be made by businesses that will help shore up the ecosystem itself. So there's a lot of things that are available to employers. And so we're going to start digging into 45F right now. All right, Emily, would you like to take it from here?
Here we go. Hello, everybody. With me, I have Josh McCabe and Megan Schulte, and I'm going to start with you, Josh. So we have heard that 45F is something new in the One Big Beautiful Bill, but very few of us know exactly what it does. So can you help us learn more, explain in plain language what this is?
Sure. Yeah, so what 45F does is provide a special tax credit for employer-provided childcare. So typically, if you were to do something like this, you would use your usual business expense deduction, and that's worth your marginal tax rate. I'll go into this after. But relative to deductions, credits are a dollar for dollar return on whatever you're spending there. So they're more valuable and they can reduce your tax liability a lot more. So under prior law, before the One Big Beautiful Bill, up to 25% of qualifying child expenses could be used for a credit up to $150,000 max. So it wasn't all of your childcare spending, it was capped at 150. And though the lower 10% rate for qualifying resource referral expenditures if you're just helping employers find something. What we see in the One Big Beautiful Bill, the big tax law that passed this summer, and I'll get into this later, this is in response to some Government Accountability Office investigations that showed why it wasn't doing so well. They made several major changes. The first one is that they increased the credit to 50% of qualifying childcare expenditures. So before you're getting 25 cents back for every dollar you spent, now it's 50 cents for every dollar you spend if you're a small firm. And I'll note small firm here means less than 32 million in gross receipts annually. So it's a big definition. If you're a other firm, medium firm, larger firm, it's 40%, which is still a lot more than that 25. They also upped the maximum credit, so up to 600,000 or 500,000, depending on firm size. And they now allow jointly owned, operated, or funded facilities to count toward this. So before, if you couldn't do it on your own, if you're in an industrial park and there's several businesses that you can go in and on this, you're allowed to do that under this now.
Great. Thank you so much, Josh. Can you tell us a little bit about who qualifies? You touched on that, the different levels, but who qualifies and who doesn't?
Yeah, so you qualify for this in terms of qualifying expenditures if you're contracting with a childcare facility, constructing or enhancing your own property to be used as childcare, all the associated operating costs, fees paid to intermediaries, and referral services. So if you are a for-profit company, right? So if you're a nonprofit, this isn't going to be particularly helpful because you're not paying income taxes anyway. But whether you're a corporate entity, whether you're a pass-through, any sort of business entity who's providing childcare services for their employees should be able to qualify from this.
Great, thank you. So you've got a couple of examples here. Can you walk us through the childcare costs with and without 45F?
Yeah, right. So I know eyes can glaze over, particularly after lunch when you're talking about exemptions, deductions, and credits. So I want to walk you through just a basic example here to see how much you can save with this credit versus without. So let's say in a given year you spend $2 million on childcare, either construction or operating costs, and there's no credit in this case. So typically, if you're a corporate entity, you would pay a 21% rate on your profits, but you're allowed to deduct the cost of any business expenses. So in this case, you are spending 2 million. You can deduct or use maximum credit up to 600,000. But it's at that 50% rate, or excuse me, you would take 21% of that 2 million, which saves you 420,000, right? So your after tax costs of building this, it's not 2 million, it's about 1.6 million. And that's just with the regular tax code. When you include this provision, let's say you're a bigger firm, you spend 2 million, you can take a tax credit worth 40%, capped at that 500, which ends up being about that 500. You would get the full credit in that case. And then whatever you have left over, you can still use that business expense deduction, right? So it's working together with your regular deduction to get you a much bigger tax refund at the end of the year. So you can see in this case, the total tax benefit is closer to 815, and the after-tax cost of building or operating that childcare system is closer to 1.2 million rather than 1.6 million. So significant savings in this case by using the 45XSF tax credit, excuse me.
Great. What misconceptions do employers have around 45F that you've heard about?
Yeah, so I think this is where, if we want to go to the next slide, we can look into the GAO report that really tried to explore pre-OBB. It had a pretty low take-up. You can see in 2016 when they had corporate returns, uh, only like a few hundred corporations took advantage of this, and the total cost was around 150 million. In terms of total tax code, that's almost nothing. And they had some better returns for individual files for those pass-through entities. And again, maybe 20,000 pastors took advantage of this, and it's in the single millions. So there just weren't many people or firms taking this up. So the GAO looked into this, and they wrote up a report, and they came up with three main factors that were limiting take up. The first is cost and complexity of providing childcare, right? So there's concern that there's a lot of upfront costs involved. There's a lot of complexity in planning and administering on-site services. You have to figure out the applicable laws, regulations of your state and locality, and that was a little scary for a lot of employers. So in some cases, the bigger credit after OBB helps out with those upfront costs. But there's still some complexity, but this is where I think places like the chamber, this organization, state agencies can really help with this, making sure that a lot of those regulations are streamlined, providing guidance, customer service, to help folks navigate the process of making sure you're complying with everything you need to be for something like this. The second one was limited awareness or understanding of the credit. Like I said, we all glaze over when we start talking about taxes. But in the GAO's experience, one representative at the group that provides childcare services to a large employer told them that almost none of their clients were aware of the credit. A lot of smaller firms aren't going to have HR or tax advisors that can tell them about it. So we know we need a bit more outreach from the IRS, again, from groups like this, to sort of spread the word to say, hey, there's money on the table for those of you who are able to take advantage of it. The second one, and I know there's some questions from the audience, is it could use some more clarity on what's eligible. Many assumed it had to be on site and weren't aware that you could contract out for services. We've gotten some clarification on that, but we're still awaiting Treasury guidance to address some of those concerns. And the last one was related to credit design. This idea that it was a bit too small when it was 150, it wasn't enough to really incentivize folks. So we've seen them raise the cap, raise the credit rate. So hopefully that's going to lead to a higher take-up rate. And then the second one is many workers prefer sort of in-home childcare that might be near their work, which typically isn't eligible under state law's definition of childcare facility because it uses state and local regulations. So this is the same in this law, but this is something where, again, Michigan policymakers can really look at 45F, look at their state and local licensing and regulatory regime, and say, how are we doing? Are we matching up our regulations so that supply can meet demand that might come from this policy?
Thank you so much, Josh. I've just got one more. So when we have this conversation about 45F, we hear a lot about intermediaries. Can you explain what that is and how it fits into this credit?
Yeah, so this is one of those areas where we're still waiting on a bit more guidance. But this is the idea that you don't have to necessarily be the one owning and operating something on your site. So in this case, the example I gave, if you're at an industrial park, there's several businesses there that want to take advantage of it. You can use you can contract out to an intermediary who can run it or operate it on your behalf while sharing ownership. So what that looks like in terms of who would be eligible, who isn't, we're still waiting. But it doesn't mean that you now have to have a second business where you're running a machine shop, but you're also running a childcare center. So it gives employers a little bit more flexibility in terms of outsourcing that to folks who might be better equipped to do it.
Thank you so much. Up next, unless we have time for questions from the audience. Oh, you've got some additional resources for us. So if you could just.
I'm a former academic, so I always put some links to things in the slide that you might read if you so choose. The Congressional Research Service, Bipartisan Policy Center, who you've heard from, is a fantastic resource, and of course, the Government Accountability Office.
And Emily, no questions yet in the Q&A, so we can move on to Megan, and I'll keep an eye on it and let you know.
Thank you so much. All right, Megan.
Hello.
Hello. No, thank you so much for being with us.
Of
So
course.
tell us a little bit about who you are, who Frontier Co-op is, and how you fit in with this childcare 45F conversation.
Yes, for sure. So first, just starting with Frontier in general, we can go to the next slide here. Give you guys a little bit of background. So we're based in Iowa. We have three different Iowa locations, about 550 employees total, with the majority of them being in those three locations there. And we are a food manufacturer. So we purchase spices from around the world. We bring them in, we process and manufacture them, package them up, and ship them out. And the reason that I bring that up is because about 2/3 of our employees are operations based employees. So manufacturing, forklift drivers, things like that. And we're running a 3-shift operation 5 days a week. So around the clock type of operation from Sunday night through Friday. But everything that we do kind of as a company is all really driven by this purpose of doing good work. So you can go to the next slide here. And what that really means is that we believe that you can do good in the world and have a profitable and successful company overall. So this kind of highlights our 3 pillars that we have. Really, where I'm going to focus our time today is where my job kind of leads me to as being the head of HR. And that's really how we make that a reality within our walls here at Frontier. And that's really where our childcare programs as a whole kind of sit, and whether that's our policies that we have available or our on-site childcare that we have currently here today. So if you go to the next slide, really our child care, as I said, is our legacy program that we have. So we've actually had it from the very beginning. We started in 1976 when we started up. Many of the employees at the time were women from farming families. So the husbands were kind of out in the field, and the women's, this is kind of where dual incomes were coming into place. And so they were actually entering into the workforce, but they were the primary caregivers. So they just started bringing their kids into the workplace, and they would take turns kind of watching them throughout the day. And that's really where our childcare kind of started. But I think it's important because we really started out of a necessity that we had to, and we recognized that this was a huge barrier in order to get talent into our business for it. And that still stays true today. And we have a licensed daycare here on site at our Norway facility. And we still have over 50% of our employees are women, which is kind of unheard of when you're running kind of a manufacturing and distribution type of business for us overall. So, yeah.
Thank you so much. So when your leadership decided to participate in 45F, what did that process look like, and how did they determine that this mattered to them? You touched on that a little bit, but
Yeah. Yeah. So if you go to the next slide, I think our leadership team at different points in time have kind of evaluated this program overall. And I think we, as I mentioned, we recognized very early on that this was a challenge, but still here today, we recognize that it is a large barrier for people entering into the workforce. And I think that people really saw that across the country during COVID for it. And even when I thought that the question at the beginning of the webinar was good, because I think everybody on the call has kind of recognized that childcare is an issue in the workforce. And now it's really, now what do I do with that? And for us, when we started to look at kind of the investment side of things, really how we look at childcare is we want to make sure that we have a comprehensive benefits package overall. So we evaluate our childcare program just like we would evaluate any medical benefits that we have, any dental, vision, 401k benefits, anything like that. It's kind of lumped into that same group for us. And so we're really evaluating kind of what opportunities that we have in this space overall. And this is really where we've decided to kind of put our dollars more times than not for it. And I think programs like the 45F have allowed us to continue to expand these types of programs longer term for us.
what's been your experience utilizing 45F? And do you have any recommendations for other employers that are thinking about utilizing the credit?
Yeah. So I think for us, 45F's been good because it's allowed us to keep things affordable for our employees. And I think that's very important when you look here. I didn't go through everything on this slide, but really the challenge that we had identified was quality and affordable child care. And at least here locally, that's really, really important for employers over or for candidates kind of overall. And so when we step into 45F, it allows us to keep those costs where they need to be in line while still kind of paying our childcare staff where they need to and still having the quality of childcare that we believe that our employees should have for their children kind of overall for it. As far as like the processing of and actually getting the credit and all of those kind of tactical items for it all, I would say we've been utilizing this program for quite a while now. This tax program, even before, obviously, Josh had touched on some of the changes that are happening, which is awesome to see. It just allows us to continue to invest here and continue to kind of build capacity within our childcare that we have. But I would say, kind of starting it up the first time, it's fairly easy, but I would say that we have some other, I'm out of Iowa, so we have some state programs where we have to categorize things a little bit differently so we can get some other credits that we have specific to us. But I would say it's fairly easy once you get it set up. And it's one of those things, once you set it up and kind of know the key things that you need, it's very easy to replicate kind of year after year for it all. So very similar to other kind of tax credits that your business would be applying for or probably already do apply for today. Brent.
What's been the response from employees?
Yeah, so they love it, absolutely love it. I would say that we've heard the phrase a lot, as cliche as it may be, is like work-life balance. And I think that Frontier is truly living that out by having a child care here on site and allowing people to not have to make the decision between their career and their family. And so that's really shown true to our employees and they really, really feel it. And I would like to call out that's important even to employees who are not utilizing the childcare today. I think we all realize that childcare is for kind of a phase of your life and you might not need it and everybody might not take advantage of it. And I've talked to lots of different employers over the years that have been here at Frontier. And one of the things that they bring up commonly is that what about the employees who don't take advantage of something like this? And I think it's a really good call out for people to make. But I would say that's why we look at childcare like we do any other benefits program that we have. And sometimes employees will take advantage of your medical plan. Sometimes they'll take advantage of your 401k plan. And it's really just important for employers to have a comprehensive kind of menu of offerings available to employees that no matter what kind of situation or personal situation that they're in or what phase of life that they're in, that you have something available for them. And so I always just let employers know, like, you should really be looking at this along with every other benefits offering that you're offering your employees kind of overall for it.
Great. And last question, unless we have any in the chat, is from your experience, what's one practical step another employer could take tomorrow if they wanted to start down a similar path as you have?
Yeah. So I think sometimes kind of looking at a large investment like childcare or anything else, it can come very overwhelming very quickly. And so what I always tell people is just take a small step forward. You can start small, and it could be something that looks like before and after school programming that you have available, or then step into just a summer camp that you have available to employees' children, and then slowly work yourself into kind of the more complex sides of things where you're taking in kind of infants on that side. But do something, take a step forward, but you don't have to jump all the way in day one. And so I'd really just recommend like setting out a plan and don't feel like you have to have it all done right away for it. But moving forward is the most important piece overall.
Thank you so much, Megan. Are there any questions in the chat? I can't.
We don't have any right
Okay.
now. I just want to say, from somebody who's been working with employers for a while, Megan, thank you so much because this, I'm just so impressed, right?
Yes, thank you. Thank you.
And I think that while some people look at on-site care and say, I could never do that, we know it's not the solution for everyone. There are lots of other things they could do.
Correct.
But when we can hear from folks who've done it and kind of step into it gently, not go into the deep end right away, that's great advice. So thank you.
Yes. Yes. And always happy to talk to people offline about how we kind of handle things day to day from the employee or from the childcare perspective of things and creative things that we've had to kind of pivot on over the years and learning. So always here.
Amazing. Thank you. We'll have contact information for everybody in the follow-up as well. And Emily, before we turn it back over to you to introduce your colleague, Shannon Garrett, we can go to the next slide. I just want to reinforce after what we've heard just now from both Josh and Megan is that this tax credit doesn't eliminate employer investment, it multiplies it. So we want to make sure that we're looking at how we're tapping into all of the resources that both the federal and state government are creating for us to alleviate this burden on our workforce and to make it as easy as possible for our business leaders and employers to actually use that. And so that's a really nice segue into what we're going to talk about next. So Emily, why don't you introduce Shannon?
Sorry, my internet just cut out, so I am back. I am thrilled to introduce Shannon Garrett. She is a senior advisor at MiLEAP overseeing the TriShare program. And it's really one of Michigan's most exciting investments, particularly after the conversation around 45F and hearing from Frontier about all of the options that they have for funding of childcare. One of Michigan's innovative solutions is TriShare. So Shannon is here to share some information about TriShare.
Thank you, Emily. TriShare, let's get into this as one of the innovative ways that the state has been addressing the issue, particularly from the workforce development side of things. So my TriShare is an employer-sponsored, publicly supported childcare benefit. So it's an innovative public-private partnership where the childcare costs are split between the employer, their employees, and the state of Michigan. It's the first of its kind in the country, and it was stakeholders coming together to find a way that they could work together to support parents, in particular, remaining in the workforce. So my TriShare is a workplace benefit that really strengthens the workforce, supports employment, and promotes economic security, not only for the employees themselves, but for the employers, for the families of the employees, and for the child care providers. So we'll go next into a brief history of the TriShare program. It's launched in our fiscal year 2021 as a one-time appropriation for a pilot of let's go out and test this idea of splitting the cost of childcare between employers, employees, and the state. And it was an idea that was quickly picked up on, especially by philanthropy. So we had organizations like the W.K. Kellogg Foundation and the Balmer Group come in because they also wanted to try this experiment in the footprints, the geographic footprints where their philanthropies are. So we took the pilot phase seriously in Michigan, and we really went out and experimented in different regions with how to deliver this as a workplace benefit that's supported by the state. And we took time to do the piloting, to do some true evaluation. We hired a third-party evaluation team to come in, talk to all of the stakeholders, the employers, the employees and their families, and the child care providers. And we used that feedback to expand the pilot. And we evaluated some more, again, including all of the stakeholders. And then we innovated directly off their feedback. And in particular, we increased our employee household income eligibility so that the My TriShare benefit could be used by more families. And we also introduced an optional My Care Share add-on so that employers could offer their 1/3 benefit to all employees. And I will talk about both of those changes in a moment. But in the meantime, the program became an ongoing line item, its own line item in the state appropriation. So that brings us to this year where we are operating the benefit statewide. It's open to employers throughout the state. And we have regional hubs who go out and do outreach with local employers, recruit them to offer the benefit. And then we have a statewide administrative partner who delivers that benefit. And we'll talk more about how that works in a moment. But the big breaking news that we have that I'm excited to share is that last week, or maybe the week before. The weeks are kind of blending together. Right before the holiday, the Michigan legislature actually passed a bill codifying My Tri-Share and My Care Share into state law. So that is awaiting the governor's signature. And once that happens, these programs will be in our state law, meaning that they will be ongoing protected programs. And we're really excited about that moving forward. So how does it work? We'll move into the next slide about how this happens. So like I mentioned, we have regional hubs throughout the state. These are partners at the local level who are going out and doing the outreach with local employers. So they're helping to reach employers with this information about what this benefit is, how it can help their employees. They're the local validators for the program. It is a unique public-private partnership, and so it takes sometimes a little bit more direct outreach to be able to reach employers to share that information. And we're excited for groups like Pulse that do these events to help us spread the word. So we have that, the hubs are out there recruiting employers, and then we have a statewide administrative partner that actually delivers the benefit. So once an employer signs on, they say, I want to offer this as a workplace benefit for my employees. Our statewide administrative partner does the rest. They handle all of the employee income verification, they handle the family enrollments, they handle the child care payment collections and payments to payments to the providers. And they do it all with no administrative fees to the employer. So that's a really important piece of it. The program, the benefit is open to all Michigan employers, regardless of your size or your sector. We have everything from two-person consulting firms all the way to very large employers like Hemlock Semiconductors, we just heard, participated in an earlier webinar. And we also have Bronson Healthcare Group today, was another one of our longtime participating employers and one of our larger employers on the larger end. So it doesn't matter the sector, it doesn't matter the size of your organization. If you're looking for a way to help your employees cover their childcare costs, this is one way that you can do it. So we have it sort of two ways that you can help your employees with their childcare payments. The first is the primary program, which is the My Tri-Share program, which splits the cost of the childcare between the employer, the employee, and the state of Michigan. And to get that state of Michigan extra 1/3, the employee has a household income between 200 to 400% of the federal poverty level. So we handle all of that. We don't expect employers to know the household income of their employees. You probably shouldn't know that. So we take care of that for you to determine who is eligible to get the state's extra 1/3. And then because we were getting feedback from employers and employees that, they wanted to be able to offer this to everyone. Employers, like I said, don't know the household income of their employees, but they know they want to help them. We introduced the optional My Care Share add-on so that an employer can continue to offer a 1/3 childcare benefit, cost sharing benefit to their employees. And if that employee's family is not income eligible, then they would pay their remaining 2/3. But we still handle all of that through our statewide administrative partner. Two other pieces of how it works. The first one being that parents can choose their own licensed childcare provider. So we don't mandate that they select from a specific list. They don't have to use on-site childcare necessarily. They can choose the childcare that best meets their family's needs. And we help them find that if they aren't already using it. And then eligible care is any licensed care in Michigan. So it could be full or part-time care, sort of your traditional childcare, before and after school, summer care. We even allow employers, if they would like to include it in their parameters, to include licensed children's camps, because we know for some areas in the state, that's often the only type of care that's available in the summertime. So that's how it works. And just to give you on the next slide here, a look at how that breaks out in terms of family household income eligibility. For a family of four, say, this is a household income of between $66,000 and $132,000. So we really are hitting that sort of middle income. A lot of people refer to it as the ALICE population, that comes from the United Way's acronym for asset limited, income constrained, and employed, which is a really long way of saying folks who are working and still not able to make their ends meet. And so we're really getting that population helped here through this benefit. And for the My Care Share option, employers can offer Care Share to continue to help the families that are above 400%. And I will note that for families who come in below the 200% household income, we do have the state's child care scholarship, and those families are often eligible to receive that scholarship, which is free or very reduced cost. But we can waive them into the TRISHARE program if it turns out they aren't eligible for the scholarship. So what does that mean for you all as an employer? So we'll move into the employer responsibilities. And the next slide, it's essentially you set your benefit, decide your budget for the benefit, and we take care of the rest. So we have it set up so that we can help you determine what the budget could be for the folks who are in your employment, and figure out what your participation parameters are. Then you sign the agreement with the statewide partner who delivers the benefit for you. You promote it to your employees, just like you do all of the other benefits that you offer, and we help provide you with materials to do that. And then you collect the employee's share of the cost, usually through payroll deduction. And again, we will help you figure out how best to set that up for your staff. And then you submit both your employer share and your employee contributions to the statewide administrative partner so that they can pay the child care providers themselves. And we do that through invoicing you pay for the invoice. So it's a pretty simple project or benefit, and we'll move into the next slide here. And again, it's offered at no administrative cost to either you as the employer or to your employees. And I do like to point out to employers that this is a benefit where you only, as an employer, you only incur costs if you have an employee enrolled and actively using the benefit. So there's not an ongoing fee that you have to pay just for being able to offer this benefit. You just pay for the benefit when it's actually being used. So we'll move into the next slide about, why would you offer TRISHARE? So you offer TRISHARE for a lot of the reasons that Kathy was laying out in the beginning about why childcare impacts you as an employer, impacts your bottom line. You offer a benefit for helping to pay for childcare, like My TRISHARE, because it's competitive recruitment and talent attraction. It's removing that barrier to employment for a lot of folks, because if they can't afford childcare, they can't afford to go to work. It helps reduce absenteeism by helping folks find reliable, ongoing childcare that is licensed and affordable and high quality. And it helps reduce your turnover costs. And we'll move to the next slide to show you how that has played out a little bit among the employees who are participating. So this is from our 2024 evaluation, which is the most recent evaluation we did. And again, this was before we did the increase on the household income eligibility and before we introduced the My Care Share option. Both of those changes were a direct response to the feedback we got in this evaluation. So even before we made those changes, we had 71% of our employers reporting that it was helping with employee retention, and 80% thought that it would be helpful in the future. 64% said it made them more competitive for talent. And as one employer shared down there in the bottom, My TRISHARE is arguably the most important benefit that they offer outside of health insurance. So it's really that helpful in keeping your folks employed. And I'll move in to the next slide to zero in on feedback that we got from one employer in particular, and that is Health West in Muskegon. Health West has been a part of the program probably almost as long as Bronson has, but they've been a part of it for a while and long enough that they started to look at what the ROI is on this investment for them in particular. And what they found when they surveyed the staff that's using the My TRISHARE program is that 80% of them said that it was a determining factor in keeping them employed at Health West. And what Health West found that among all of the employees that were using the benefit was that their average salary was $63,000 for each of those employees. And the average annual MyTriShare cost per employee was less than $2,000. So Health West figured that for the 80% of those folks who say the benefit keeps them there, the cost of turnover for those kind of at-risk employees would be almost $1.2 million just based on their salaries, while the combined cost for Health West's share of the benefit was $35,000 across all of those employees. So they're spending $35,000 on a healthcare or on a childcare benefit to save them $1.2 million at a minimum of turnover costs. So that's a pretty significant return on investment. And this is just from one of our more than 300 employers that are using the MyTriShare benefit. I will note, and I don't want to steal any thunder from Kathy, but Pulse will be releasing some case studies that they've done for us, showing how other employers are using MyTriShare, including the Bronson Healthcare Group that you'll hear from later in this webinar. And so I'll wrap it up, moving into the next couple of slides here. Just, what does it mean for working families? It means they're reducing their childcare costs by 2/3 or 66%. It means that they're getting help finding the licensed care that meets their needs, and it's improving their work-life balance. And it's removing that significant barrier to not only finding employment, but maintaining their employment. And we'll move into what we found in our 2024 evaluation. There was the huge impact that's having for employees. So, 97% of families saying that it was improving their financial stability. And the biggest testimonials that we get, and we continue to get to this day from employees and their families, are around two really big points. One is two-parent families where one partner is considering leaving the workforce because their entire salary goes to childcare. When one of their employers offers the MyTriShare benefit, that reduces their costs and allows them both to stay in the workforce. The other piece of feedback or testimonial that we hear quite a bit from both employees and employers is around folks who are now able to move from part-time work into full-time work. We've heard from employers who are like, I've been trying to get this woman to work for me full-time, but she couldn't because she couldn't afford the childcare. But now that we offer the MyTriShare benefit, this person can now move into full-time work. We also hear that around promotions, where somebody has wanted a promotion or an employer has been trying to promote somebody within, and they haven't been able to because of the cost of childcare or the changes that would make. But because MyTriShare helps them afford the childcare they need to make these moves, they've been able to keep that talent that the employer has already invested in. So that's really exciting. And then when it comes to the next slide on overall family savings, we have found that overall, over $15 million in total family savings on licensed childcare using the MyTriShare benefit. So that's across the state. And then finally, we'll talk about the providers. So there's, if you've sat in on some or listened to some of the earlier webinars and heard about where we are in terms of childcare and childcare capacity and slots and all of that, MyTriShare is one of the ways that the state is helping to invest in the childcare sector. So it's helping those those providers get timely, reliable payment for their childcare services. We heard from providers that said, I know some of my families would not have been able to afford to stay with me or to pay their invoices every month if it wasn't for this program. And I'll just offer one last, highlight an unintended, but a very highly beneficial side effect that we found when we launched this program is that providers have been able to offer this benefit to their own employees. So not only do they participate as providers providing the care for the employees of other employers, they were like, wait, could we participate in this as well? And so they are able to help maintain their staff and their capacity by using this benefit program for themselves. So what's next? What's next is all of the exciting new innovations that we're going to be able to do, especially implementing this new law once it's on the books. So being able to take the fact that this is now going to be codified in state law and how we're able to expand this program and offer it to more employers to offer it as a benefit, continuing to evaluate and respond to feedback, and looking forward to increased funding and innovations that are going to allow more employers to offer this benefit to working families across the state. So the last slide here is just my contact information that's included for folks. Please feel free to reach out if you have any questions at all. And if I can't answer those questions, or if you want to be connected to your local regional hub to have them come in and do a presentation like this, we can make that happen. So with that, I'm going to pass it over to Kathy, see if there's any questions or
Shannon,
question.
thank you so much. That was incredibly helpful. And I know you got a shout out in the chat also. Thank you very much for your information. And there's also a question here from, let me see, I lost it. It's not there anymore. Andy, if I allow you to come off mute, Andy Richards, would you like to ask your question yourself? Trying to do that. Hang on one second. One moment, please.
I think I did find the
Did you
question
see it?
here. Yeah.
Okay.
It seems the MyTriShare process needs to start with the employer. I'm wondering what would help increase the uptake of the program with more employers in Michigan. Does there need to be a greater incentive for the employer to engage in the program? That's a really great question, Andy. Thanks for that.
You're welcome. I am off mute, I guess. So if you need a follow-up, go ahead.
Thank you. So yeah, it doesn't necessarily have to start with the employer. Actually, we have a lot of employers who've come on board because their employees have brought it to them. We've also had providers who share it with the other families that use them as care, who then go out and share it with their employers. So there is a renewed effort now to beef up our outreach at the local level. And I don't know, Kathy, if we've talked about regional childcare coalitions much in this webinar series, but the MyTriShare hubs are at the table in those coalitions talking to our business and employer partners at the local level to really start that one-on-one sales outreach. I don't like to use the word sales, but we are working on getting employers to offer a benefit here, and that's how we're getting them involved.
That's great. And don't get me wrong, 300 employers is a great start. But we know there's probably a lot more out there that could be taking advantage of the benefit, right? And so that's the reason for the question, is how do we recruit more?
Yeah, and I really do think that this codification that's about to happen is going to make a big difference in that. One of the other pieces of feedback that I didn't talk about during the presentation is that employers were hesitant to offer a benefit that had the word pilot linked to it, or that wasn't sort of in state law as an ongoing program, because they didn't want to start offering a benefit that could be taken away. So being able to get the legislature to codify this is a huge step towards alleviating some of those fears. And I think all of our hubs are going to start circling back to all of those employers to help that way as well. I know that that's not the end all answer, but it is one exciting development that we have.
Yeah, and then a follow-up question about whether or not TriShare qualifies for the 45F. So if they're paying for that, this is another one that I was hoping we would get to. And do you have any more clarity on that, Shannon or Josh?
Yeah, I don't. I would defer to Josh, but I think Josh did mention that there's a number of pieces that we're hoping for guidance to come out of the Treasury Department. And this is one of them, whether or not these cost sharing pieces count. I don't know if Josh has any additional information.
Yeah, there is something on against double dipping. So if you use, the same dollar, you can't use a credit in deduction, something else. But as far as I know, if your costs exceed whatever the worth of the credit is, you can potentially apply a different credit or a different program to that leftover cost. But again, still waiting on Treasury.
And is there a limit in the budget to how many employers or employees could participate in TriShare? Thank you for that, Josh.
Yeah, thanks, Josh. And thanks for this question, Jennifer. We are only limited by the appropriation that we're given by the state legislature. So we don't have an exact number on that because it ebbs and flows depending on how employees are using the benefit. If we get close, we're going to let folks know. But right now, we can accommodate folks who want to sign up and offer this to their employees.
Thanks, Shannon. And I know that we're closely following the Bipartisan Policy Center, which is closely following, like Josh is, any of the rulings that are coming out. So stay tuned and we will send updates as we learn them, because we do know that while we're not giving any tax advice, you need to actually consult your tax advisors for that. We do want to make sure that folks have as much information as possible. I am curious if Josh could come off again and talk about, like, get a little clearer about what double dipping would mean. How could this be seen as double dipping? Could you clarify that a little bit more?
Yeah, so the idea is if let's say you spend 500,000 on childcare and then you claim the credit worth 500,000, you couldn't then claim other tax benefits for that same 500,000, right? So in the same way, first you would burn through your credit, and then the leftover you could use as a regular business expense and deduct it. If you couldn't for the same dollar deduct it with multiple credits in that case.
So what advice would you have for an employer who wants to like best navigate that terrain that feels pretty bumpy?
Talk to an accountant
Yeah.
who is pretty up on the law in a given year. All my advice is always talk to an accountant.
Yeah. Yeah.
I always joke that policy folks and economists, we know the high level, they know the nitty-gritty of what will save you money and what will get you in trouble.
Josh, one last question on this, and I'll let it go. But if you were under the cap, right, that's allowed by 45F as an employer, you couldn't use TRISHARE money that you spent on help towards the TRISHARE program. The employer say we spent $50,000, right, and we were well under the cap. Say that was all we did, right, was to put money into TRISHARE. We should still be able to claim that on 45F then for the tax credit, right? We're putting the money out. The state's not giving us money. We provide money to the program.
So I think that's where we need clarification on whether that would count as a qualifying expenditure for
Sure.
45F.
Yep.
Yeah.
Yep. That's what we're looking for, is that
Yeah.
clarification.
Yep. So stay tuned. We were hoping that doing this webinar, thank you, Josh, this far into the year that we'd have more clarification on this. Honestly, we started these conversations in January and we thought, well, we don't know enough at all about this yet. There's still a lot to be done. So we were really hoping that by mid-July, there'd be more clarification. Stay tuned on that front. We'll do what we can. I do want to just share that Andy Richards, as such an incredible childcare champion for us in the state, has been working with us in Southwest Michigan specifically to talk to our economic development organizations to really understand what barriers exist for the employers who have chosen not to do TRISHARE, don't know anything about it. And so we're working with some of our economic development partners to start exploring business roundtables that would be specific to this kind of feedback loop. Like, let's demystify some of the things. So Shannon, just keep your phone on, because I have a feeling there'll be a need for additional presentations for folks who may not be here right now, but who need to know a little bit more about it, especially now that it's codified. To your point, I think that is going to make a difference, because people needed to have some confidence in the program. Now we've got data. Now we've got codification. We're moving in the right direction for this to be. And, you know, states all over the country are looking at us for this because they know that this is something that they can do. And so we're also learning from the other states that have adapted it themselves and learning, because the first one out is always the toughest, right? You're the one who gets all the bumps and bruises and everybody else comes behind and looks a little easier. But so thank you for your leadership on this.
Thank you. I did see one other question. Do we have time for me to answer that?
Sure. Yes.
The Q&A. Adam was saying this is probably something we would do during open enrollment. How far in advance should we reach out? I would say that's entirely dependent on the decision-making capacity of your organization. So for some businesses, we've been able to have a conversation with them and get them signed up and rolling it out within the same month. For some businesses, it's taken over a year, well over a year, because of the decision tree that happens within that organization. But I would say that if you feel confident that this is something that you could get through leadership and offer to your employees, we could help you get it rolled out within the same month. It's really just a matter of getting you and the statewide partner linked up so that you can work out your agreement and the parameters for your benefit specifically, and then start rolling it out to your employees.
Thank you, Shannon.
Yeah.
Incredibly helpful. And I know that this is, there's a lot of details that go into this, right? And so one of the things that we're hearing that we're going to continue to work on is that figuring out how to budget for it, right? That's a big question we get from employers. So, stay tuned as we are gathering information from the partners that are part of TriShare. That is this part of the point of our case studies is helping you learn from others who've actually done this. What does it look like? And we'll talk a little bit with Bronson in a minute about that as well. We do have one more question about 45F. I'm going to hold on that, Maggie, until at the end. Let's get us through this, and then we'll revisit questions in a minute. So thank you very much. All right, we can go to the next slide. Yeah. Another reminder, I can't emphasize this enough, and if you were at our last webinar, it is really important for you, if you're an employer or you're supporting employers, for folks to start from a place of knowledge, of really understanding what the current landscape is, not only in their community as it relates to childcare supply, but what their workforce is experiencing. So when you visit the Pulse Roadmap website, you will have access to a survey that will allow you to gather some of that information. We suggest that if you want to quantify the ROI, so like you're making investments, what's it going to mean for us? We actually have connections to the ADECO calculator. I was going to say calendar. I'm like, that is not right. And it is not. That will help you quantify that. There's also some suggestions on how you get internal buy-in. How do you get leadership to actually support initiatives that are like this? And then we cannot encourage you enough to, if you do not belong to a regional coalition yet, you should. So just reminding you that the resources are available. You're not doing this by yourself. Next slide, please. Thanks. There are 3 roles that employers can play in this space of what we're doing. And one of them is really about inside your own walls. And I think that our folks at Frontier really demonstrated this well, right? You lead inside your company, what's going on there, and that you create some solutions that are going to help your workforce directly. Most folks who enter this conversation, though, learn that it doesn't stop at their walls. The challenge exists out in their community, that there aren't enough slots. We're going to hear a lot from Bronson about how they've stepped into this second space, not just staying with what are we doing for our own employees, but how do we help the ecosystem that is in our community. And the third is really around advocacy. How do you use your voice as an employer? That's going to be the focus of our 4th webinar coming on August 12th. So we want to make sure that, the focus of this whole thing is investing in affordability. Helping employees pay for care is a big part of taking the burden off of them. What that looks like for you may vary considerably. And so that's why we've got so many different options on the roadmap. We've got some examples here, but we've gone through all of those in the past. We can go to the next slide. Thank you. We're next talking about expanding access. That's going to be a big focus of our next webinar. Again, this is just another way for us to remind you of the things that are available to you and the roles that you can play. And we can go to the next slide. Thank you. So your regional childcare coalition, I already mentioned this a couple times, and I know others have as well. Folks there are working on building the supply of childcare, creating synergy between the different sectors, trying to strengthen the businesses themselves, improving the workforce, and collaborating with employers. If this is something that you're not connected to yet, get in touch with us, and we will make sure that you get connected to the one that is in your region. Okay, now for the exciting part of talking to some folks on the ground who are actually doing this. We are joined today by Chelsea McMullen and Charity Alderson, who are with Bronson, and as you heard, are one of the biggest users of TriShare in the state, which is pretty exciting. And they became one of Michigan's childcare champions, not because they found one magic solution, but because they built a portfolio of supports, and they started by listening. And so we're going to just do an interview here with the 2 of them to really kind of dig into what their experience has been and what they've been learning. Okay, you can go to the next slide. All right, just a little bit about Bronson. I'm not sure if either of you would like to share a little bit more than what's on the screen here about who you are, but I'll leave it to you for that.
I can share a little bit. So I'm Charity Alderson, a System Director in Human Resources, so System Director of Employee Wellbeing and HR Transformation here at Bronson Healthcare. We're in Southwest Michigan. As the slide shows, we have over 9,000 employees and several different locations for main hospitals. And I will say that we have 5 generations in our workforce. The majority made up of millennials and Gen X, which makes a difference sometimes when we look at childcare. And 80%, over 80% of our employee population identify as female as well. So with that being said, though, I do want to say we do know that families who need childcare are not always only that traditional female, right? Starting out a family. So the dynamics look very different. And with our employee population being large and in the 5 generations, we see a lot of different folks reaching out for childcare needs. So that's a little bit about Brunson and our dynamic here.
All right. Thank you, Charity. Next slide, please. So I'm going to ask this of both of you. You can decide who wants to answer each of them, or you can both answer if you've got something that you want to add. Why did Bronson decide that childcare was a workforce issue? Like, what started this whole thing for you?
Yeah, so I'll kick us off. As I mentioned, just what makes up our employee population definitely makes a difference, I would say. I don't know everybody on this call and how big your employee population is, but we know that for our organization, childcare is not a childcare is a workforce necessity, I would say. So it's not only a family benefit. We have heard directly from our employees based on internal surveys that we have taken to collect feedback to understand what those childcare needs are, and also through an employee voice survey around engagement, and then as well as some community data as well. To know that for sure, finding affordable, reliable childcare affects, the ability to work, to accept those new positions, to stay employed, to advance their careers. So that childcare availability and cost as well, it impacts all of those things that I think every employer hopefully is trying to stay ahead of, such as what is listed on this slide with the attendance and the retention and recruitment and well-being, all of those things. So our employee and our community assessments have showed that significantly that the childcare needs, particularly in our counties and in Battle Creek, Michigan, many employees indicate that they would change their childcare arrangements if they had better options available and so forth. So we've gotten really insightful data to support.
Thank you. Anything you'd add, Chelsea?
No, she hit the nail on the head. It's a lot of work that we're doing to dig to find out where there's potential opportunities, and we've got a lot of great feedback to start driving some of those solutions.
Awesome. Thank you. So how did your leadership become convinced that you needed to do something about this?
This is something that our leadership, our organization has been focused on for quite a while. So while we keep trying to find innovative ways, which we'll talk more about in a bit, it is definitely always top of mind. And we see it as both a people issue and a business issue. So based on that feedback that I just mentioned, and then workforce challenges, especially in healthcare. I'm sure you've heard about that, on the news. It is real, right? The struggle of the workforce challenges that we face here. And then also, the community data, which organizations like yours and others have provided, it demonstrates that the childcare shortages, they have created many barriers as it relates to recruitment and retention. And that especially started, I would say, back in COVID when, the world kind of stopped and changed in many ways. And then now even still there are schools who, they close early on a certain day or have restricted hours and such. So we know that that impacts both our employees and our community. So I would say that this also aligns to our organization's strategic priorities. And we have that people pillar that we focus in on all the time. So that leans into not only that workforce stability, which has been mentioned previously today, but the employee well-being and then the health of our community as a whole. And leadership definitely recognizes that supporting our working families, our employees as working families, as creative as we can, and meeting them where they're at in their life journey, it improves not only that employee engagement and I feel cared about as an employee and so forth, but we're also strengthening the communities that we're serving. If we show up well, that impacts, our patient outcome and so forth.
Chelsea, anything to add?
Not that one. Thank you, Charity.
You're welcome.
Does a good job explaining it all.
Well, feel free to jump in when you need to. I can.
She's going to answer all the tri-share.
Right.
She's our tri-share expert.
All right. I can share that, I've had the benefit and the honor of sitting around a lot of tables with Bronson's leadership where they are genuinely concerned and invested in the success of their teammates, right? Like when they are not just saying, I'm just going to have to find another nurse because this one's not going to work out. They're like, what do we do to invest in the people that we need to have here? And we know that they have lives outside of work, and it's not just people who have kids 0 to 5. I think you mentioned this, Charity, right? It's the people with school-age children who still need care before and after, or if school closes, summer vacations, those kind of things. And I know that there was also, Bronson was one of the first employers to the table with us when we started in 2021 having these deep conversations about what could be done around childcare. We were just at the cusp of, I don't say we were exiting the COVID era, but things had become a little more lax so we could be in a room to talk about it at least, right? Mm-hmm. And there was a real concern about how we were going to support our healthcare staff specifically, who had to live through a pretty traumatic thing, and we're still dealing with the aftermath of that. And initially, the employers that we were engaging were looking for a single solution. They're like, just fix it for us, right? And what I appreciated there was an understanding pretty early that there wouldn't be a single solution. Right. But Bronson was willing to it wasn't a gamble, it wasn't a risk, but it was willing to take the courage to be one of the first ones to engage in tri-share and to say, this looks like it might work for us. We're a 24/7 operation. We have a lot of folks that we need to keep here. And we have a lot of folks that we know would qualify even under the first iteration of my tri-share. So Chelsea, tell me a little bit about why tri-share.
Yeah, thank you. And first and foremost, it's going to sound like I'm repeating a lot of the same stuff that Kathy and Shannon have said, and that's okay because repetition is a form of learning, so I'm okay with it. But yeah, like you mentioned, it was in 2022 when we started offering this benefit as part of a pilot program, and it was kind of a leap of faith, right? Because we didn't know if this would continue, if this is something that was going to have a true impact, but we are sure thankful that we did join because we are able to help hundreds of employees and dependents each year. And we had other solutions. We found that some of these other solutions, like you said, one size fits all, it's not a single solution. It was targeting specific populations based on location where this benefit supported our entire organization because we have 4 main locations and they're all over Southwest Michigan. So we wanted to ensure that all of our employee population was able to take advantage of a benefit that's available to them. So that's one of the reasons. It's also it's a practical, scalable solution. It allows the cost of childcare to be shared between the employee, the employer, and the state of Michigan. So that reduces the cost, as you mentioned several times now, by up to 2/3 for those eligible participants. So it gave Bronson the opportunity to make an immediate impact on affordability while leveraging a proven statewide model. It also gave us a way to support our employees across, again, like I said, all of our organizations, regardless of locations. As long as you're able to find a licensed provider in the state of Michigan and you fell within that ALICE population that Shannon spoke about earlier, you were eligible for this. And so it was something that we found that it would be extremely impactful, and it has proven to be extremely impactful over the past 4 years.
And so do you have any recent data about how many folks have been supported through your TriShare efforts?
Yeah, we're working on getting some 2026 data. We're working with our hub. It ebbs and flows just because during the time of the year and things like that, I know right now we have 40 plus applications that are pending approval. So that's definitely going to spike our number up for 2026. But for 2025, we had, for year to date, we supported 143 employees and 198 dependents. Already in 2026, currently, we are supporting 116 employees and just shy of 200 dependents currently. So that's not the year-to-date total. We're working on getting that, but that's current state.
That's amazing. Thank you. And each one of those numbers is a family that can breathe a little easier, can, do some more with their family that they couldn't before. So that's great. What implementation lessons have you learned?
I think the experience it helped us recognize that reducing costs alone isn't enough. Which is why we're exploring other opportunities, such as the Garden of Dreams and Valentine Center partnership, which Charity is going to talk about a little bit later. She's been working closely with that. Employee awareness and communication are critical. Employees must know about the benefit to take advantage of the benefit. So that's a critical piece, which we partnered with our hub to create a lot of communication, and we had a really strong communication plan internally to communicate that on an evergreen style. Childcare challenges vary a lot by region, as Charity was talking about. On Battle Creek, they struggle a lot with access to care, so that's an area of opportunity for us. Partnerships matter, so working with the United Way, our hub, childcare providers, and then community organizations, it expands the impact that it'll have on this benefit and our employees. One solution is not enough. Affordability and availability must be both addressed. We're helping with the affordability piece, but we need to really focus on availability and access to care as well. And then employers should just be prepared for ongoing employee education, as we talked about, like the evergreen style communication, so our employees are familiar with this benefit.
Thank you so much. And you're measuring impact in what ways right now?
The most meaningful measure we have had so far is based on employee utilization and feedback. So we've seen a growth year over year in the utilization for our employee population. We continue to get feedback, whether that's via surveys. Just cases. We use cases where our employees come to us about questions and concerns. And we have had several scenarios where employees have told us directly that getting a dollar pay raise somewhere else isn't going to offset this wonderful benefit that they have here at Bronson. So it is the way that the reason why they choose to stay at Bronson as an employer. So that's some of the ways that we're tracking it right now. You were just talking about some tools and resources that we could use to get like maybe a financial ROI. We're not really tracking the financial ROI as much as we are we know it is helping with our recruitment efforts. We know it's helping with our retention. We know there's an ROI in there. We just don't have all of those data points right now.
Amazing. Thank you. Any unexpected benefits emerged?
Beyond workforce benefits, we have seen a stronger community partnership, increased awareness of childcare challenges. Things like this webinar today will help with that as well. Opportunity to support broader economic development efforts, again, which Charity will talk about here in a moment. So childcare discussions have opened doors for a lot of collaboration that benefit employees, families, and the community.
Amazing. Okay. And anything just to close this part up that you're hearing from the families themselves that you'd want to share?
I would just reiterate that this sometimes is a deciding factor of whether or not they're going to be able to stay an employee at Bronson. We're consistently hearing from our employees that this benefit relieves so much financial stress. It makes quality of childcare more affordable for them. They like that they get to choose a licensed provider of their choice and still take advantage of this benefit. The ALICE population, as we were talking about earlier, they're not qualifying for other types of subsidies and aids. And so we're helping a population that doesn't normally get that type of support, but is still barely making ends meet. And so we've heard that a lot from that population. And so I think it's the overall theme is that it's providing really meaningful support during a phase of life when childcare is expensive and can be particularly challenging.
Thank you so much. And just to close it out completely, any advice you'd give to anybody about where to start?
Charity, would you like to take that one
Yeah,
on?
I'll take that. So I think it's all about starting somewhere, taking that small step, keeping impact in mind, right? So thinking of it as this is a strategic path that has a lot of stepping stones along the way. So the childcare challenges, they impact all employers of any size, and you do not need to build your own childcare or run your own childcare center yourself as an organization to make that difference for your employees and for your community. So programs like this TriShare program that we're speaking about, and then partnerships with community organizations allow employers of any size really to address those workforce barriers that bubble up often and put practical ways in place and solutions. So the question isn't really whether childcare affects your workforce, I would say. It's how you choose to respond to it. And one small step, such as something like I say small step. I know it wasn't small for everybody, but truly it's so impactful. And as previously mentioned, it doesn't take a ton to implement. It is so impactful. So start somewhere, collaborate, lean into others who you know. We have partnered with many healthcare organizations in our state just to understand what they're doing, what it looks like in their community. And collaboration has been key, definitely.
Thank you, Charity. And you've inferred a little bit about some of these partnerships and the other solutions that you are exploring and implementing. Do you want to name any of those very explicitly in the few minutes?
Yeah. We have one exciting project that we are getting ready to cut the ribbon on at the end of this month. So across the street from Bronson Battle Creek in Calhoun County, Michigan, there is a childcare center which is sat vacant for a while. And due to collaboration and knowing what the data tells us, right, from our community and our employees, it's like, hey, there's this beautiful building sitting across the street. It's going to need some work. What can we do to be part of a community idea and concept to help with the childcare needs for not only our employees, but our community? One, how do we stay in our lane, right? We are healthcare providers. We are not childcare experts. So trying to understand what that could look like. So there were many collaborative meetings with community partners, a foundation, local city government who actually owns the building, by the way, so we couldn't buy the building. And then daycare organizations. This one in particular that we are partnering with is called Garden of Dreams. And together came up with a memo of understanding from our part, where we are investing over the course of so many years, and we have a certain number of childcare slots for our employees and some prioritization, and it's expanding the number of childcare seats for the Valentine's Center as well. The building will be remodeled completely, I should say. It's in its final stages of all of the passing of the tests that have to go on at all the different levels. So it's super exciting. And to stay engaged, because I mentioned like we're in healthcare, we're not in childcare, we still want to have a seat at the table. So part of our understanding in this partnership is that we will be having some board seats. So we have a few board seats, and then we want to engage in some community engagements together with the childcare center and with our partners. So this is a partnership with a few other community partners, as I mentioned, who are all investing in their own way. And we believe it'll make a pretty big difference, especially in Battle Creek. So we're super excited.
Well, that's incredibly inspirational, and I know pretty exciting for those of us who I'm sitting in Battle Creek myself right now. So I could tell you that when the Valentine Center's former childcare business closed rather abruptly, it shook the community, and it was a lot of slots, and the risk of it being gone forever was pretty scary. And so this partnership that has emerged, I think, is a textbook one that other folks should pay attention to and learn from, because not one entity could have done that, right? It took a real collective effort to make that happen. And so leaning into what might be scary, what might not be your lane, but knowing that you have something to contribute is really important. And these are also things that we bring to our regional coalition meetings, right? It's where we talk to it. Robin Beasley is the director of Garden of Dreams, and she's come to our regional coalition in Southwest Michigan to share with everyone what she's done and what these partnerships look like. And we have employers in the room who then are hearing, oh, I didn't even know a partnership with a childcare business would be something I could do. So I do think these things spark for others what ideas are. So I want to thank you both very much. And I know that there is a question, at least one in here. Have you experienced any pushback from employees that don't receive equal benefit? It's a challenge that they're saying that they face when engaging employers? And if so, how do you tackle it?
No,
Well,
not necessarily.
oh, you want to say? Go ahead.
We can both add something. So I wouldn't say necessarily this because we're not just providing one childcare solution. We offer other childcare solutions that we can, support our employees. So I think if we weren't maybe offering a lot of different options, that might be a situation we might come to. But because we're providing a lot of different solutions, I think that we have something that can meet the needs of anybody in our organization. Charity, do you want to add to that?
Basically that we don't have a one size fits all approach. We don't always fit the need of everybody. We continue to try, but with like all the things with flex spending or our lifestyle spending account, which can't necessarily go direct to childcare, but it can impact some things that help as a caregiver. We have a lot of different benefits and ways that we try to help. And so TriShare has definitely been really impactful, and the way that we communicate it and share exactly who qualifies, I think, is very helpful. So right at a glance, it's out there, right? It is what it is, not, and then that's one solution that we have in place, one resource. We do not get a lot of pushback, and I think it's because it is very clear on who qualifies. And
we've also heard from employees often that will say, I can do my job better because my teammates are here and they're consistently here and they can be present. So there is a benefit that feels like it exceeds those who receive the financial benefit. But it's also important for us to note that folks don't have the same view when it comes to who takes care of or takes advantage of health benefits or other benefits that you get. So I do think that there's some cultural shifts and some mental models that can be pushed back on a little bit inside organizations to help people understand that. Not everybody takes advantage of every benefit, but they are available to folks, right, when they need them. And so that's an important thing for us to look at. So I want to thank you both so much. This was really incredibly, I think, insightful and great for folks to hear from somebody who's actually doing this. I want to thank you for your local leadership and also your willingness to help others borrow your brilliance. So appreciate that. We will make sure that we have some contact information for folks if they want to reach out, but we'll manage that afterwards. I do want to transition really quickly because we'll probably lose folks because it is 4 o'clock. Please take a picture with your phone of this and provide us feedback on this webinar. It really helps us. We read every single one of your comments and every response because we want to know whether or not this is meeting your needs. We'll leave this up for a second while I announce that on August 12th, there is going to be our 4th webinar, and we would like you to participate. If you can't, you will receive the recordings. And I know we didn't get to all of the questions, but we will make sure that we look at our experts for those. We will save the chat and we will get those back to you when we send out the recording. So I want to thank everyone who has stuck around a couple minutes later and really appreciate your time, your attention, your commitment to trying to move the needle on this and to be a part of a movement that is going to make sure that our families with young children in Michigan are well taken care of in every possible way. Thank you.